The algorithm that you do you provide that for all of your clients? Is that included in your report?
The specific algorithm is not included in the report. We do provide a textual description of how to interpret the results. The algorithm itself, along with much more detail about this type of testing, is available on our website.
And what's the distribution? What are you seeing in terms of the presence of star 17 and some of the other polymorphisms in the work that you've done so far?
So we're right now seeing allele frequencies of 30 to 40% for the variants. The most common is the star 2 that we are seeing in roughly 25% of people. We are seeing star 17. We haven't had as much time to evaluate statistics, but at least in 5 to 10% of patients, we are observing the star 17. And then some of the other variants, star 3, star 4, 6, 8, we have observed not in high frequencies, but it's there. And clinically, they have the potential to be very important. So I think an expanded panel is warranted.
Thank you. Alan, so where do you think all of this is going to shake out? What's the timeline in terms of this? It seems to me that it's clear that a functional study along with the pharmacogenomic study is probably the best approach, and is going to provide physicians with the most amount of information for managing their patients. Do you have a timeline where you see that that's going to be incorporated into the normal workup of these patients?
Well, the problem is that to do a randomized study based on 2C19 genotyping will be very expensive, and nobody will pay for that because Plavix is going off patent next year, and there's little motivation by the pharma industry to include these tests, including Bristol Myers Squibb, who makes Plavix and could benefit by having, prescriptions for more drug. Yet they have not really stepped up to the plate to sponsor these kinds of things. So we're left with a quandary here of black box warning. We should do something. We just don't know exactly what. And I think it's going to be incumbent on clinical practice to sort this out.
Thank you very much. If you have any questions, be happy to answer them. Otherwise, thank you so much for your attendance today.